In this video, discuss about slow virus disease. What are slow virus diseases? The term slow viral disease applied to group of infection in animals and human beings, and this is characterized by very long incubation period, slow course, and ultimately terminating fatal. And this concept was proposed by Sinkwertson, who was a veterinary pathologist. Slow virus disease, it is a group of disease. It causes infection in human and animals. It have long incubation period, slow course, but ultimately terminating fatal. Now, what are the various characteristics of slow viruses? Incubation period ranging from month to years, and the course of illness lasting from month to years, with remission and exacerbation. This disease mainly they have free deletion for involvement of CNS, and there is absence of immune response in infected persons. Genetic predispositions, ultimately invariable fatal terminations. So, what are the other characteristics of slow viruses? Incubation period long. Then, course of illness lasting from months to years. Here, remission and exacerbations. Then, free deletions for involvement of CSS. There is absence of immune response in infected persons. Now, classification of slow virus diseases. It classified into three main groups: Group A, Group B, and Group C. Group A, they are slowly progressive infections of sheep like Vishna and Medi. That is caused by serological related non-oncogenic retrovirus. Okay, it is called that lentivirus. Another example, HIV. So, Group A virus, Vishna and Medi. Next, Group B, comprising prion disease of CNS, scrappy, mink encephalopathy, Kuru, and CJD. All this collectively known as subacute spongiform viral encephalopathy. Group B virus, that prion disease caused by CNS. What are the diseases? Scrappy, mink encephalopathy, Kuru, and CJD. Group C, consisting two unrelated CNS disease of human beings. They are subacute sclerosing panencephalitis and progressive multifocal encephalopathy. These two diseases of human being, Group C. Next, diseases of human. The disease subacute sclerosing encephalitis. Subacute sclerosing panencephalitis. Agent measles virus, host human, incubation period long incubation period, and nature of the disease is chronic sclerosing panencephalitis. Second one is progressive multifocal leukoencephalopathy. This agent polyomavirus host human, incubation period very long period, that nature of disease CNS demyelination. Next, Creutzfeldt-Jakob disease CJD. Agent Prions, host human, chimpanzee, and monkey. Incubation period month to year. The nature of disease fungiform encephalopathy. Next, one more disease, Kuru, agent Prions, host human, chimpanzee, and monkey. Incubation period month 2 years. The nature of disease fungiform encephalopathy. Next, diseases of human. First one is Visna, agent retrovirus, host sheep. Incubation period month 2 year. The nature of disease central nervous system demyelination. Next, Scrappy, agent Prion, host sheep, goat, and mice. Incubation period month to years. The nature of disease spunkiform encephalopathy. Then bovine spunkiform encephalopathy, agent Prions, host cattle. Incubation period months to years. Nature of disease spunkiform encephalopathy. Then transmissible mink encephalopathy, agent Prion, host mink and other animals. Incubation period it will take few months. Then disease spunkiform encephalopathy. Then chronic wasting disease, agent Prion, host mule deer, elk, and incubation period month to year. Then disease spunkiform encephalopathy. Let's talk about group A diseases. First one is Vishna. This is demyelinating disease of sheep. This is characterized by paralysis and death in the sheep. This was eradicated by slaughtering of all infected animals in the year of 1957. Second one is Miadi. It is slowly progressive hemorrhagic pneumonia of sheep. And these two diseases belong to group A diseases. Now group B diseases, prion disease. This disease in animals, it causing infection, scrappy, mink encephalopathy, bovine spunkiform encephalopathy. It is also called as mad cow disease. Then infection in human, Creutzfeldt-Jakob disease, Kuru, and fatal familial insomnia. Fatal familial insomnia. These are the diseases comes under group B diseases. And now pathology. Infective agent is proteinous in nature, called as proteinous infectious particle. This one don't have any DNA or RNA, so that is called as prions. Prions are basically proteinous infectious particles. It causing infection. It don't have any nucleic acid in the form of DNA or RNA. Prions means proteinous infectious particles. This one don't have nucleic acid in the form of DNA or RNA. This one resistant to physical and chemical agent. They can be transmitted to animals by oral or parental. Who gave that name? Stanley B. Brusner gave that name prions, so he got Nobel Prize. Here that PRPC, prion protein cellular, are common. This one presented in normal human. It will change into PRPSC protein, that prion protein scrappy. This PRPC, this cellular, this one prion protein cellular. This one is changed into PRPSE, prion protein scrappy. So now what is prions, how they causes disease? Here the cell internalized by neuron itself. So that neuron, suppose this one is our nerves, okay, nerves internalized by PRPSE. This one they accumulated in the cytoplasmic vacuoles, so it give that spunky form appearance. That PRPSE, this one will bind to PRPC. This one is the cellular. It is presented in normal human, our nerve cells. So this PRPC, it will producing lot of PRPSE, that's scrappy. So here lot of PRPSE. That now internally taking up this PRPSC, they accumulated in the cytoplasmic vacuoles, giving the cell-like spongiform appearance. The cell look spongiform, the vacuoles containing PRPSC. That's why the disease name is called as spongiform encephalopathy. It affected no, neurons, that brain. Today topic of discussion is prion. Prions are even more primitive than virus because prion have only protein. Virus, it have protein plus nucleic acid, either DNA or RNA. So only protein means prion, along with the nucleic acid means virus. Prions are infectious that are causing diseases. Let's see how they work. Prion are infectious protein particles without nucleic acid. This one is the infectious protein particles without nucleic acid. They have two isomers. One is PRPC, another one is PRPSC. Prion protein scrappy. This one is disease causing form of prion protein. This one is the disease causing form of prion protein. This one is just protein. It is found in our body. This one, why this one having scrappy? Why? Because means the sheep always scratches itself because it was so itching, scratch itself everywhere. So it is a infectious one. PRPSC, it carry itself to neuron and it is carry to neuron to this PRPSC. This PRPSC bind with the PRPC. PRPC. It is a cellular protein found in our body. So this two bind, it will converted into PRPSC. Now so many PRPSC, they get aggregated. They causes amyloid like plaques. So these are some insoluble protein. Amyloid insoluble protein. So amyloid like some plaque are created. Basically a lack of immune response. Slow virus under this heading it coming. The body will not get immune response against this. There will be lack of inflammation also. And now what happened? The cells internalized by neuron itself. Internalization. The neuron internally taking by PRPSC. That neuron, this one is the neuron means it internally taking that PRPSC. The PRPSC are accumulated by the cytoplasmic vacuoles, cytoplasmic vacuoles here accumulated, giving the cell spunky form appearance. So it producing, it giving cell to spunky form appearance. All the vacuoles containing what? The containing all the vacuoles containing PRPSC. PRBSC bind with PRPC, where it is going to nerves. The nerves internally takes place, taking up this PRPSC. They accumulated into the cytoplasmic vacuoles, giving the cells like spunky-form appearance. The cell look spunky-form. The vacuoles containing PRPSC. That's why this is called as spunky-form encephalopathy. The neuron are affected. So what is causes of prions? Basically, what and all we hear: vacuolation of neurons, plaque will be there, proliferation of hypertrophy of atrophy is there, then fusion of neuron and adjacent glial cells. What are the causes? Vacuolation, plaque, then hypertrophy, astrocytes, then fusion of neuron, adjacent glial cells. Let's discuss slow viral diseases due to prion. First one is in human. First disease Kuro. Kuro means drama. This was first identified in 1957 in Trifin, New Guinea. This one incubation period 5 to 10 years. Infection believed to be due to cannibalism. Okay, what is cannibalism? This is the tribal custom of eating dead bodies. Okay, eating dead bodies of relative after ritual non-sterilizing cooking. After ritual non-sterilizing cooking. The abolition of cannibalism, the disease has disappeared. Second disease name is called as Creutzfeldt-Jakob disease. Creutzfeldt-Jakob disease, CJD. This one is the most common in human. Dementia, myoclonus and death. So CJD causes dementia, myoclonus and death. This may be familial and aerogenic. Then what are the sources for CJD? This can be occurred by improper sterilization depth electrodes or cornea from infected persons transplanted to other person, in human growth hormones given from infected persons, the durameter graft and gonadotropin which is received from infected person, then through surgical instrument. So CJD is also known as iatrogenic disease when physician induced this disease. Dementia, myoclonus death, then aerogenic infection from physician, it induced the disease. This one also familial. Gerstmann Schwarzer Skinker disease, GSSD, present with a slowly progressive limb and tyrannical ataxia as well as dementia. This one predominantly involvement of brainstem degeneration. The neuropathology of GSS is remarkable in that extensive and invariable amplified deposition occur. Next one is fatal familial insomnia. What are the presentation? Insomnia, dementia, motor paralysis, then hypothermia, hypertension. These are the things. So, what are the human diseases? First one is Kuru, second one is CJD, third one is GSSD, fourth one is fatal familial insomnia. In animals, scrappy, sheep, goat, mice and mink. Bovine spongiform encephalopathy. The host is cattle. Transmissible mink encephalopathy. Host mink. Chronic wasting disease. This one host mule deer and elk. It is a protype of prion disease. There are the two types, natural scrappy and experimental scrappy. This one, natural scrappy, that incubation period of 2 years, affected sheep become irritable. So incubation period 2 years, affected sheep become irritable. It have intense to very itching for it. So basically what happened in the sheep, after the incubation period of 2 years, they vertically from parent to offspring it can come or direct contact the sheep got it. 2 years of incubation period, the affected sheep become irritable and it develop intense scraping themselves against trees and rocks. So the name given scrappy. Trees and rock scrap their body. Finally they causes paralysis and death. Second one is, what is that experimental scrappy? This disease can be experimentally transmitted to various animals. So they are injecting the neural tissue of infected sheep to the other animals like hamster, mice. So they are getting from infected sheep to study the progress of disease, etc. Mad cow disease caused by these prions. Foot and mouth disease caused by virus. Mad cow disease caused by prion. Now, spongiform degeneration. Initially, intracytoplasmic vacuoles 1 to 5 micrometer. They appear in neuron as this is CNS disease. So whatever pathogens occur, this is inside neuron. So in intracytoplasmic vacuoles appear. As a result, progress vacuolization become more pronounced. The cortical neutrophil develop a spongy appearance. Hence the term spongiform encephalopathy. Due to spongiform develop, the spongiform encephalopathy occur. Osteosclerosis, neural loss also occur. So what are the other condition? Osteosclerosis and neuronal loss also occur. Next, group C diseases. It causes two type of disease. One is subacute sclerosing panencephalitis, SSPE. Second one is progressive multifocal leukoencephalopathy. Second one. Then what is subacute sclerosing panencephalitis? This one is delayed measles viral infection, progressive deterioration of mental and motor functions. Brain cells show that evidence of measles viral infection. So here delayed measles viral infection, progressive deterioration of mental and motor function. Then this one is progressive multifocal leukoencephalopathy. This one is rare demyelinating disease in elderly persons whose immune response is impaired by immunosuppression and malignancy. This is JC virus, member of Polyoma viridae. Then demyelination of CNS also occur. This one progressive deterioration of motor function, visions, and speech. So death occur in 3 to 4 months. Progressive multifocal leukoencephalopathy, a rare demyelinating disease in early person whose immune response is impaired by immunosuppression and malignancy. This one is JC virus. Demyelination of CNS also occur. This one progressive deterioration of motor functions, vision, and speech. Death occur 3 to 4 months. Next, laboratory diagnosis. Confirmation dependent immunoassay, MRI brain scan, then DNA sequencing can also done. So laboratory diagnosis done by three important method: conformational dependent immunoassay, MRI brain scan, and DNA sequencing. Next, brain biopsy indicative of this is how brain pathology occur by using that method: spongiform degeneration, then cloiosis, then amyloid plaque. Biopsy, brain biopsy, spongiform degeneration, cloiosis, and amyloid plaque. Then CSF also taken. Then EEG, electroencephalogram, CD scan, Western plotting of PRPSC. Then PRPSC can be detected, that prion protein scrapy can be detected by ELISA, tissue section by immunohistochemistry. So by using these are the method, we can identify the slow virus diseases. Confirmation dependent immunoassay, MRI brain scan, DNA sequencing, brain biopsy indicated by spongiform degeneration, cloiosis, amyloid plaque, CSF also taken, EEG, CD scan, Western plotting, ELISA, immunohistochemistry.